Thank you, everyone. I'll give also a little bit of background about myself, and then I'll leave it up to you, Ahmed, to talk about the whole idea of actually coming up with Prep Pharma. So I am actually the only non-pharmacist in the family. My mom is a pharmacist. My brother is a pharmacist. They are both foreign trained. So when they came to Canada, I remember I was still young back then, and they were going through the equivalency process and the struggles and all of that. And that was actually the part that inspired me to get into this part of the academics. And what happened later on is I started to practice. I'm a dentist by profession, so I started to practice and also teach. And when we started the Prep Doctors, which is the mother company, I know that you, Ahmed, you were in the process of qualifying your degree. So you did the first exam and the second exam. So you finished the evaluating and the MCQ, passed them from the first attempt, but then the business became overwhelming. So you put it on hold and you took the position of a COO, Chief Operating Officer, helped us out to set up and advance the branch in Prep Doctors. And after we actually fine-tuned the approach, we started to expand into other branches as well. And later on, Prep Pharma came into the play, and then you decided now it's actually the time to go back to your origin. So I will leave it up to you to talk a little bit about what inspired you exactly. Why is this the time that you think Prep Pharma should be launched? And if you can give us some background about how the approach then Prep Doctors actually helped you decide that.
Absolutely, absolutely. First of all, I'd like to thank you, Dr. Marwan, for taking the time to host this event. I know you're extremely busy with all the educational programs that we have, mashallah. And also, I'd like to thank everyone who joined in the webinar. I heard from our IT department that the turnout is actually quite good. So thank you, everyone, for taking the time to join us. So I'll touch a little bit on what you said on how we started this whole thing, because I am a pharmacist by profession, right? And back in 2011, when we founded Prep Doctors, I was in my last 2 years of pharmacy. So we started around summertime, if I remember correctly, and then I went back to Jordan, University of Petra, and I did my last 2 years of pharmacy education, and then I came back in 2013. This is when I graduated from Petra, and I got my license in Jordan. I'm practicing pharmacist there, and when I came back, I faced a little bit of a struggle because I know the science that is taught in Jordan is really good. It's excellent. But the thing is, the trick here is you want to learn the Canadian way of doing things, of how to become a pharmacist. So I was, I just graduated recently, so I was stuck in that decision. Should I rely on my information or should I see what's in the market and, start practicing for my exam? For the first one, for the evaluating exam, I decided to study on my own, and I went ahead and I did the exam, and I passed from the first attempt. So, and then afterwards, I was like, you know what? I really need to get myself more ready for the MCQ and the OSCE. I didn't want to wing it, to be honest, because as everyone knows, it's 3 attempts, and a lot of people, they say if I do the first attempt, I can just risk it, see what the exam's like. But I think that's definitely a wrong approach, because as soon as if God forbid you fail your first attempt, then the pressure will start building up and the stress. So it's really essential to get proper education. And this is when I actually started searching in the market to see what's available. I joined few courses. I'm not going to mention any courses in name, but some courses were decent. Some of them, they were not engaging at all. I actually attended maybe for 3 weeks, if I recall correctly, and I just left. I could not continue. So I decided for MCQ as well to just rely on the references listed in the PEBC website, and I studied on my own. And I attempted, and from the first attempt, alhamdulillah, I passed as well. So afterwards, around that same time frame is when Prep Doctors started picking up. And I remember when we initially discussed Prep Doctors, it was something that we're doing on the side. But as time progressed, and as we saw the effect that's having on people, it genuinely became the main focus of our lives. And around that time is when I said, you know what, I'm just going to put my equivalency process on hold just to put more emphasis on Prep Doctors. And we started working more towards that and building that aspect.
And just sorry to interrupt you. I remember at that time, dentistry was going through the same thing. Also, dentists who were trying to qualify, they were also confused. There was no courses in the market that were decent. They were looking for information from here and there. And one of the challenges, by the way, if you look at pharmacy, dentistry, medicine, nurse, like anything that is regulated in Canada, you go through the same phases over here. So I think at that time, that was what initiated the idea of prep doctors, was because I'm a graduate from University of Toronto. And when these candidates came, I had colleagues from different countries. They were looking at how should we prepare, because they don't know the Canadian standard.
Exactly, yes.
So that was the missing link. So we started it. Thank you for joining forces. So you put it on hold, and then you were building the process. And now we are the largest institute in that field. And anybody who wants to go through dentistry, they have to come through Prep Doctors. So it was a great help for them.
And Dr. Marwan, if I may add a point, I remember, I recall that even your brother faced that same difficulty, right?
Yes, he was. It was very stressful, by the way. Actually, the whole idea, what was motivating me to get into this was my family, because I saw how difficult it is for them, especially like my mom, more than that, because when you have children and you have to care for them and then you have to qualify, it's very tough for people to go through that. And the other thing is, when there is no structured guidance, you're always calling people, trying to collect information from here and there. It becomes stressful. And as you mentioned, you prepared for evaluating by yourself, and you prepared for MCQ. I'm pretty sure you did a lot of research and talking to a lot of people.
Absolutely, yes.
But when it comes to OSCE, which we will talk about later on, the communication part and the Canadian approach, you cannot.
It's really good thing that you mentioning that point, because that was one of the reasons why I delayed OSCE, because I know for OSCE specifically, you can't just wing it, or you can. It's a lot of it is communication, a lot of it is practice. So that component I could not, like, you can't really risk that that much.
So just to put a summary then to when you talk about the inspiration, I know you've been with us, Prep Doctors. Now we are at a place where anybody who's thinking to qualify, we take them from A to Z.
I was just going to mention that, because if you look at Prep Doctors as an institute, the vision initially started with dentistry, but now we're actually in generally in the healthcare professions and healthcare field. And that vision, I'm always a pharmacist, right? I've been studying pharmacy. Like, I was a pharmacist. I know, like, in the back of my mind, even while I was working in operations, I was like, at some point I have to go back to pharmacy. Yes, I am back to pharmacy, right? And this is where the inspiration came from, because what I saw was achieved in Prep Doctors for dentistry is genuinely is impressive.
Yes.
And I'm saying that with all my heart. It's absolutely fantastic, and it's almost perfection, what's been done in dentistry. And now when you see dentists from the first point of the equivalency process towards the last step, and you see that effect on their lives, it's just the amount of trust that the dentists are putting in Prep Doctors. I really wanted to see it in pharmacy as well. This is a one-stop shop, Prep Doctors, and they don't have to worry about anything else. They're dealing with a lot of stresses as it is. So now they have they come to Prep Doctors. We have an amazing administration, amazing client relationship team, and they take them from the process from A to Z. And, like, they pass this exam, they go to the set. If God forbid they fail, there's a lot of support for that. So that kind of experience is unmatched. And I really wanted to see it in all the healthcare professions.
So that's why here now I will start to talk about the different branches of Prep Pharma, just to announce so people know the development has started actually early 2023. So a lot of work has been taking place in the background in terms of material development, in terms of process development, in terms of platform developments. That's why we are ready to launch in 2024. So the process, if I want to simplify it, it's in pharmacy, it has 4 phases. So phase number 1 will be to actually get your profile accepted and your profile approved. And I will talk to Dr. Isra about that. Then you go to the evaluating exam. And then after that, you go to the qualifying exam, which has 2 branches, the MCQ and the OSCE. So the development that took place in Prep Pharma under your supervision covered those 4 aspects. So I will start with Dr. Isra about why is it important for someone who's just thinking to become a pharmacist to have that guidance from the beginning. although a lot of people try to do it by themselves, but what is special about Prep Pharma that you are now directing in order to help people get just that first step approved?
And the most important thing to be precise with your information with you when you're applying for the document evaluation. You should know what exactly information you need to transfer to the PEPEC to be documented evaluated right. This is the best thing. This is the best thing you can do. It will be more precise about your information. So in Prep Pharma, we can provide them with one-to-one session, counseling session, to smooth this process, to remove any concerning or any struggle may face them.
So if you allow me to ask, the processing time, like let's say you submitted all the documents. So I understand there's a lot of documents you have to submit in order to create the profile, and there's a certain process you have to follow. So if you submit everything right, how long does it usually take to?
It takes from 6 to 8 weeks.
How many?
6 to 8 weeks.
6 to 8 weeks.
Yeah.
And if one document there's an error in one of the documents?
After the 8 weeks, they will contact you to send the missing document. Yes.
Okay. Yeah. And that will take again.
Yeah. The thing that previous, before 2 year or third year, you can do the document evaluation and you can make your evaluating exam in the same time. But now you can't apply for the evaluating exam until you complete the document evaluation completely. So if you don't complete your document evaluation, you will not have the ability to apply for the evaluating exam.
Okay. And I also heard there's updates that are taking place right now.
Yeah, there's a new update. We are waiting for the announcement update in the 4th of January, 2024. The update will be on the application form and the fee.
Okay. So just to summarize what Dr. Isra was talking about. So anybody who's actually just thinking to start this process, they need that first step. So the first step, usually I know, for example, for dentists, we guide them. The same thing is going to be for pharmacists and Prep Pharma under your supervision. So anybody who's willing to take that process, they can email info@preppharma.com, not .ca.com, info@preppharma.com. You can book a session one-on-one and then...
And we will respond within 24 hours and we fully support them.
Okay, so they will be supported. You can have one-on-one live session to tell them what documents they need. So that the whole idea is to get it right from the first time in order to minimize the processing time. Okay. Thank you, Dr. Isra. I'll move to Dr. Daniyah. So I know that you graduated from United Arab Emirates.
Yes.
And you have finished and cleared your first exam, the evaluating exam. And when we were chatting before, you said that you struggled in your preparation for this exam.
Yeah.
So I want you to highlight, because you're directing the preparation for this exam, what's unique about the evaluating course at Prep Pharma?
Okay.
What did you do different for people? And how do you think this is going to actually cover up for the struggles that you went through in your preparation?
Sure. Thank you for the introduction. I graduated back in 2012, and then I worked for 8 years in a hospital pharmacy where I gained a lot of experience there. I came then to Canada. I studied 1 year as a pharmacy assistant so that I can take the experience of the Canadian healthcare system. After that, I started to think about doing my exams. I checked what courses are there in the market. I applied for one of them. And throughout the course, it was very hard for me to check other people with students, meet with other studying groups. And after struggling, I met some people who told me that they have some feedback, and some of them who sat for previous exams. They told me there's a lot of certain topics that in my current course I couldn't find, like it wasn't too much relevant or it wasn't covered as much as they mentioned. So I started looking for other resources and I started checking with other studying groups that took a lot of my time and a lot of efforts, especially, like studying groups and students, like it's some sort of very hard to find because everyone is doing it privately. So it took me a lot of time. And then after that, because of all of the effort I put, I passed my exam in January 2023. What we did here in Prep Pharma is that we took all of the experience and the knowledge that we have from the university, because the evaluating exam is covering all what we studied in university. So what we did is that I applied all the information I have from the market and from my experience, along with the feedback that we are taking up to date from the students that are sitting for the exams. And I joined it with the information that we already took from the university to make direct points. Like it's not very brief, but at the same time, it's not a very wide sea where people get lost. And I don't want students to go and look for information everywhere and try to find it and look for different question banks. As Dr. Abu Saleh just said, it's a one-stop shop. So I want everything to be available from them from A to Z.
Okay, so just to comment on that, so there will be booklets given to people in the course, and
Yes.
will that be sufficient for them to study?
Yes,
for this
they
exam?
will have all the information they need. They will have question banks that will cover the topics while they are studying, and at the end of the course, they will have mock exams where they will feel that they are in a live, real situation of the exam.
And during the course, there will be ongoing quizzes.
Yes,
that
where they
assess
will also be rated, and if there is anything that they need support or if they need any guidance, we are all here for them.
Okay, now one thing I want to highlight is the team that we have here also is not the entire team. We have also Canadian graduates with us.
Yes.
And this is one of the formulas that we use for prep doctors. We're applying in Prep Pharma, where we have internationally trained pharmacists and Canadian graduates.
Yeah.
The internationally trained pharmacists, they provide people with the experience of going themselves through the process. And the Canadian graduates will provide with the references and the background and the standards that are taught in universities in Canada.
Yeah, I want to add one thing also that we mentioned like a couple of days ago when we were talking. The candidates that will be applying for the course are either people who graduated long time ago, and these people will need a complete refresh on what they studied in the university, or people who freshly graduated where they don't have either the practice because they didn't practice, or they just came into Canada so they don't have the Canadian experience. So in Prep Pharma, we will be helping all of these groups to achieve what they want to achieve.
Okay. So one more point, I think I'll leave it at the end because it applies to all the courses, the trackability of candidates.
Yes.
So I'll talk with Dr. Abu Saleh here about it. So after finishing the evaluating exam, which is, I believe it's the exam that you have to study the most for.
Yes.
Then you move on to the qualifying, which has an MCQ and OSCE. So Dr. Sara, the MCQ, again, I know that you are a practicing pharmacist, so you have been through the process. What's challenging about preparation for MCQ, and what's unique about Prep Pharma course that was being developed under your supervision?
Oh, hi everyone. Thanks for joining. So about the challenges, from my experience when I was preparing for the exam, the challenge is I was looking for something that really prepares me for the real exam. So I found some differences. When I prepared the first time, the theoretical part was all taken care of, like the studying part. I knew all the information, therapeutics. I thought I had all the knowledge, right? But when I went in to do the exam the first time, I found a gap, which is problem-based learning that was missing. So the exam focused a lot on the practical part, which
So
is
it's
like case.
the application of knowledge.
Yes, application of your knowledge. So I felt like I was lacking that part. Like I needed to be trained on a lot of cases, because that's really the core of the exam. How to problem solve, how to go through the case and apply what you know, and in order to solve the case and the question. And you have to do all of that in like a span of a minute or two. So you need to practice.
And are the cases long usually?
Yeah. They are like 1 page long. So
Oh, the case is 1 page long.
Yeah.
So it's like gives the background, medical, and a lot of
yes,
information. Okay.
yes. So you have to be really quick. You have to go through all what you know in your head already and apply it fast. Pinpoint what the problem is, what the drug therapy problem is, and go through all the scheme and find the answers. So this is where I struggled. So I went in to take the exam the second time, and the second time, this is what I focused on. And I passed the second time. That was back in 21.
So how did that experience help you shape, and what's unique about the course of MCQ
so
at Prep Pharma?
that experience that I had the first time, because, you know, like any failure is a disappointment, right? So like I went in the second time and I succeeded, but like I learned this through experience, because I had to fail the first time to learn this, right?
Yeah.
So this is what I try to do when we're preparing now with Prep Pharma for the MCQ course. The focus on problem-based learning, case solving, because this is what really matters. Yeah. And of course also we have other things that are unique, which is the one-to-one support. We are here to support all the students.
So just I want to stop because you mentioned problem-based learning, because this is an approach actually that is used by some universities. So what you mean by problem-based learning is learning the background from a case presentation, correct?
Yes.
So does that mean that the lectures that you will be providing, they start off with a case, with an actual case?
Yes.
So that people are accustomed and they are used to the exam, and then you discuss the background of the case, and then you solve the case.
Yes, that's how we start. We start with the case, so they get the exposure, right?
Yeah.
And then the whole lecture would be about how to approach the case, what are different examples. We talk, of course, about the theoretical part, but then at the end, we go back to the case and we try to apply everything we learned.
So it's like a hybrid.
Yes,
it's
a
like
hybrid model.
A hybrid model. So they start with a case, but then you go to a traditional way of presenting the background info.
Yeah.
So like, let's say we're talking about cardiovascular, it's a cardiovascular case. They see the case, then you teach the background of cardiovascular, and then you go and solve the case.
Yes.
And is that how the whole course is going to be structured?
Yes, pretty much, yeah. So it's more engaging, more interactive. It emphasizes on like the critical thinking skills.
Okay. So that means from day one, they're doing the exam. Pretty much, like from day one, they're doing cases of the exam.
We want our students to get accustomed to this too.
Okay.
Like to get used to this structure.
And this is the main difference between the first exam and the second, I believe. The first one is more theoretical, like you have to study in a traditional way.
Broad, like all the topics, but in broad. They don't go into much details.
Okay, and the second one, you start to apply it in detail. So you need to focus on a certain area. Okay.
With MCQ, sorry.
Yeah, no worries. I think you just mentioned also to me that I didn't know that you also went into a lot of courses to gather the information, and I think you struggled the same way that I struggled. Like you had to gather all the important information and look into various resources to be able to pass.
To find the answer, yes.
Okay, and I believe like since we're talking about the approach that we talked about, Dr. Abu Saleh, is applying the same as prep doctors formula, which is every course is going to have all the material provided. There will be ongoing assessment, which are quizzes along the way. There will be mock exams at the end. And all of that is going to tie into the passing guarantee, which I'll talk about towards the end. So the MCQ is it's part of the qualifying exam.
Part one.
And I believe that people can take it alone or they can take it in combination with the OSCE, right? So they have that choice. So here I'll move on. So I'll move on to you, to Dr. Baghdadi, to talk about the OSCE section, which is the last section. Do the majority of pharmacists take it together or alone? Like, do they separate these two parts of the last step, or do they take it together?
Okay, so first of all, thank you, Dr. Marwan, for hosting this event and for everybody joining us. Just first of all, I wanted to follow up on what Dr. Ahmed mentioned in terms of the struggle like the candidate usually face when they are trying to apply for the exams, mainly the OSCE exam, right? When I did the OSCE exam, when I first attempted it, it was in terms of I didn't know how to study, which course to take or which product to use, and I was honestly studying it as if I was studying the MCQ. But it does require application of your knowledge. Whatever you learned in the MCQ, basically, whatever you learned in therapeutics and management, you apply it for the OSCE. And this is where Pharma is coming, right? They are designed basically to focus on your communication, because most of the candidates would be internationally trained pharmacists. And unfortunately, I learned this also from my experience that we are lacking the communication and counseling part. So we are focusing more on the communication part. And in terms of the course with the MCQ, I've noticed most of the candidates would only attempt one exam at a time. But at the Prep Pharma, we are focusing on aligning both courses together for those candidates who would choose to go for both exams at the same time or at the same session.
So both options are present.
Yeah, both options are present. And to facilitate this option for candidates going through both at the same session, we aligned the topics that which are going to be presented on a weekly sessions. So we align the topics with the MCQ. Let's say cardiovascular topics would be given in a certain week for the MCQ and the OSCE. So they get to study the MCQ part for the cardiovascular, for example,
And then
followed
practice.
up exactly by practicing the OSCE stations for the OSCE exam.
Nice.
So I know that for OSCE there's a big communication part, a
Right.
huge communication part, and then we'll talk about a little bit the structure because this is one of the main obstacles pharmacists face, I believe, in the process, because communication is something that is completely lacking. By the way, not only in pharmacists, in any
Right.
international healthcare professionals.
Yes.
Now I know you're a pharmacy owner,
Yeah.
right? So do you find that after practicing pharmacy in Canada now it's much easier to go do the exam? Because I think counseling is part of your practice here.
I would say absolutely, mainly for the OSCE. Unfortunately, I found it lacking until I was exposed to the Canadian market. I did a great deal of volunteering and pharmacy assistant work before becoming a licensed pharmacist. So I honestly, in every setting of pharmacy practice, whether it's a community pharmacy, independent or franchise, they do require effective communication skills, whether they are verbal or non-verbal, of course. And this you have to master by practice. And at Prep Pharma, we are focusing mostly on the communication aspect, plus, of course, the therapeutic aspect and the management part.
So
Right.
here I'll talk about practice, because you
Right.
said communication is practice.
Right.
And this is something that is very important for people to understand, is to learn how to do the counseling cannot be taught in one day.
Yes.
It can be in theory, but you're not going to master
Right.
it, let's say, in one day. You have
Absolutely.
to take it in slow steps. So here we'll talk about the structure of the course. What's unique about the Prep Pharma OSCE course for candidates?
Right. Thank you. So in terms of communication, of course, they say practice makes perfect, right? And that's why at Prep Pharma, as you said, theoretically, it could be learned, but when you actually apply it in practice, in order to master it, you have to do it spread out. You cannot just do it over a crash course or a quick session. We would divide it into many weeks, different weeks, including in every week you will have a weekly practice session where you would get to practice in a state-of-the-art facility, which actually is designed to exactly mimic the OSCE exam, right? So the candidates would be going through the exam rooms or the stations as if they are doing the actual OSCE exam. And this is also provided with different actors on a weekly basis, not only through the final mock exams, right? And that will build their confidence when they communicate on a weekly basis until they master the skill to go actually for the
And it will
exam.
be divided by topic, I believe, right? So
Exactly.
like, for example, cardiovascular, they're going to have a week of practice of cardiovascular stations.
Right. So thank you for this question because I wanted to mention something about this. It's not only per topic. We want to also cover to cover all of the competencies in the PEBC, the examining board, right? Which are the 9 competencies. So we are not only going to cover the topics, which are the therapeutic topics, but we have to cover all the competencies to make sure the candidate is more than exam ready. Right?
Like health promotion, professional
Health promotion, for example, knowledge application, patient care, which is the biggest part. So we have to cover all of these competencies along with the communication of the candidate and the therapeutic part, of course.
Okay, so you mentioned about the facility. I just want to note that we do have the setup of rooms.
Yes.
So there are stations already, a location for that. That's available every week. So let's say I'm a candidate who's going to take the OSCE course, right?
Right.
So every week, how many stations do I get to practice with professional actors?
Yeah, for at the Prep Pharma, that's what's great about Prep
That's
Pharma.
astonishing.
Yes, it's so great about Prep Pharma compared to all other products in the market. No other product is offering this, only Prep Pharma, because we get to resemble exactly the exam setting. The candidate will have the exact feel in terms of anxiety, the fear, and then with time or with weekly practice, they will develop the confidence necessary to actually tackle the OSCE exam. And not only this, they will be also ready to be more than confident to work in the Canadian pharmacy.
So how many
So
consultations?
how many stations, going back to this, it's the candidate will practice at least 5 stations every single week for at least 10 to 12 weeks of interactive cases. And also they will do a couple of weeks for non-interactive plus management cases, right? And then they will be practicing a lot of cases, also using the learning management system at Prep Pharma.
Okay, so these cases, let's say I practiced, I did 5 cases. How do they get evaluated? Do I have access to them? How is the discussion done? So if you can tell us more about that.
Yeah, absolutely. Yeah. So besides the actual practice part where they go through the stations with the actors and the references required to pass each station, they will be also viewing their performances every single week through video recordings, which we have in the video library at Prep Pharma, right?
So the stations they go through gets recorded?
Every single station, yeah. So they actually can view their performance, their communication, and also they would get one-on-one evaluation with the assessors. They will be provided with a standardized checklist based on the PEBC criteria. Mainly, we're gonna focus on rating based on the 3 things mentioned in the PEBC, which are the communication, the outcome, and the overall performance. Not only this, they will also have, after each practice session, it's going to be followed by a weekly discussion session. So every week there will also be a group discussion session where they're going to attend to have the tips to see how each case should be approached and how it should be communicated. And also they will have access to all of the practice cases material, as well as any tips we can add in one-on-one consultation, basically.
Okay, nice. And I know that you were working on a video library.
Right.
You yourself, like in the past, I saw that you guys were doing these. So one person was playing the actor one. So tell us more about the library. And I don't know if are we going to be showing a sample of that today?
Yes, I guess we have a sample of the video library and the video recording of the case that we practiced together. And this is just a glimpse of what Prep Pharma practice sessions would be like. And that's on a weekly basis again. So we are working also on a video library to refer back to see how each case should be approached with the different
Just like the ideal answer
ideal answer, and sometimes we would provide the non-ideal answer just to show how to communicate oppositely, for example, and how it not should be done.
Okay, because this is actually very intense discourse. We have something similar, by the way, which is called situational judgment. So it's exactly the same.
Yeah.
So I know that the facility is going to be shared, but this makes a huge difference to candidates, because the more stations they do, the more they practice, the more they watch themselves perform, they start to improve automatically with the feedback.
Yes.
So for the OSCE course, it's a duration of 14 weeks. So they're going to get at least a 10 week of 5 stations each week.
For each candidate. Yeah.
For each candidate. So they go through it. Right. They get individualized marking based on the checklist. Right. And then there is a general discussion for those stations.
Yeah.
And they're not going to only get, I believe, the 5 stations. They get to practice 5 stations, but they get exposed to more.
Yeah, that's the great thing about Prep Pharma. They get to practice these OSCE stations independently. So each one, again, will go through the stations as if they are doing the OSCE exam and not in a group setting. And then they will be provided with the tips and the feedback in the beginning on how they should go through the stations through, of course, our initial sessions of the communication skills and how to approach OSCE.
Dr. Baghdadi, will you be covering through the theory part, touching it on each topic when you go through the cases?
Exactly, and that's where we're going to do it in the discussion part, following each practice session. on a weekly basis. We're gonna do the discussion sessions to see how these cases should be approached. For example, if you have a standardized health professional or standardized patient, how we should communicate to the different people, and how we should approach, for example, the different range of emotions, let's say, for patients. I know in dentistry they also have at prep doctors, they do cover this part in a great deal. We will also focus, let's say the patient is sad, frustrated, angry. We will also focus on that and how we should communicate to these patients. Because, of course, in real life, this is what we're actually facing when we're practicing. Yeah.
No, that's great. So I know that the library is being built, almost being finalized. So just for the sake of time, because we're running towards the end, we can actually have it on the website. The video, people can access it. I just want to mention again to people, preppharma.com is the website. It's not .ca, it's .com. So preppharma.com, the contact is there. The courses are all offered over there. But to conclude the session, I want to come back to a feature that applies to all of what we deliver in Prep Pharma, which is the LMS, the trackability, and the advantages of the on-site delivery of courses. So I'll leave that to you, Dr. Abu Saleh, to comment.
Honestly, I want to start with the online versus the on-site. Because when we were in the initial stages of launching Prep Pharma, of course, we consulted in our network. All of us know a lot of pharmacists, and we ask around and see what's... one very common question that kept coming up is, why are you holding the course online? Why not on-site? I mean, why not online? Because there are pharmacists everywhere. You're gonna broaden your audience when you do it online. Honestly, and the reason is, to summarize it, it's 12 years of experience talking. We've been doing the equivalency, training for 12 years, and we saw the differences. Nothing compares to on-site. Yes. Now, don't get me wrong. We have options for people with difficult schedules, because I know some of them, they hold a job or multiple jobs. So we have a solution for that. But we want the primary or the focus of the teaching to be on site for interactivity. It gives us also more leeway to discuss things openly, to properly converse with the candidates. And honestly, one point that not many people mention, this is a standardization exam. We want to give the edge to our candidates, right? When you do the content on site, that means, only our candidates will have access to that. We want to protect our material and give our candidates the edge in passing the exams.
So I just want to comment on the on-site, because we also get the same requests in dentistry and all the other fields, nursing, stuff like that. So on-site, actually, first of all, the experience is different. The type of candidates are different. They're more serious. They come here, they're prepared. They are in an environment that is conducive to learning instead of sitting behind the screen. They're not focused half the time.
Absolutely, yes.
And by the way, also when we did the replays, they come on-site to watch the replays.
Exactly, yes. Yeah.
So everything is on-site. And also they get to know each other. So they start to form study groups. So the whole idea of education is to improve the passing. We want to make sure that people pass at the end of the day.
Yes.
How do you ensure that people pass? You set metrics, you create the environment, but the other side should be serious and dedicated as well.
Yes.
Yes.
And that's why when we design our courses, on-site is actually the way to go. We have the facility, we have the environment, and so forth. But here I mentioned a point before during the passing guarantee, and we'll point out to the LMS system. So at Prep Doctors, we have this LMS where everybody who actually registers, they get a profile opened and they get enrolled in a course. So this is the same Prep Doctors, Prep Pharma, they have a platform. What's the purpose? The purpose is you are going to be tracked. Also, on-site is important for someone to be tracked. Tracked in what? Attendance and performance. So passing guarantee is not a free passing guarantee. Passing guarantee means show us that you have put the effort and the time to study, and you are following our roadmap and what we're advising you to do. And then if you don't pass, we have your back. But we're not going to actually guarantee to someone who doesn't attend the course, who doesn't attend the quizzes, who slacks off, or who's under pressure and he cannot perform. Because always, if you want to engage in a process like this, you have to free yourself. You have to actually put the effort in. So passing guarantee has metrics. The first metric, attendance.
Yes.
You have to achieve
Yes.
90% of attendance plus. You have to show up. You have to attend the course. Number two, you have to attempt all the quizzes. And you have to achieve, so you get practice questions, which you don't get evaluated on.
The self-assessment.
Yeah, the
yes.
self-assessment. And then you get a quiz. And in the quiz, you have to perform. So you have to achieve a metric to pass the quiz. And then in the mocks, you have to pass. Now, if you achieve all of those, and then you don't pass, we have your back. But you know what happens when you achieve all of those? You pass.
You pass.
Exactly.
Yeah.
You pass. So you have now two
You did your job.
motivation. You don't want to repeat the course and you want to pass. So that's actually the formula that we have developed. And when we look at candidates, we actually don't have candidates that achieve the metrics and they fail. Because the minute they achieve the metrics, that means they have put a lot of hard work, and with our guidance, then they actually end up clearing this
Absolutely.
process.
Yeah.
Yes.
The track
It's true.
and can I actually add
Yes. Go ahead.
two more points regarding the online versus on-site? Some people brought up the fact that, like they're not living in close to Mississauga, to where we're located. Like, do we have any other options for them? And to that I say, okay, we're very versatile. If there's enough demand in a location, and they can approach management and they tell them, like, we have this bunch of students who want to join the course, but they cannot come to Mississauga, then we can actually set up satellite campuses very quickly.
They're already set up, by the way.
Oh yeah, yes, we have in Calgary already, we have in Montreal, we have in Vancouver.
We have
We're
in Dubai,
present-
we have in India, so
We're present in the national and international stage. So the expertise is there to set up very quickly. But we cannot compromise on the on-site experience. Now, for students or for candidates who have difficult schedules or they have jobs during the week or in the weekend, we have unlimited access to the computer lab, where they can actually watch all the content that was taking place on site. They can go to the computer lab and watch it any time of the day. They'll get their own access card, and if they want to come watch at night, they can watch at night. Watch early in the morning, they can do that as well. So we don't want to limit access. We really want the best experience overall without compromising on anything.
Yes.
So that's the answer to that.
Yes. I mean, Dr. Mo, I don't know if we have a few more minutes just to
Yes.
play a small part of the
Oh yeah, yes.
of the
are
of the
we,
OSCE case.
yes, I think we will just people can access
Yes.
on the website
Okay.
just for the time's sake.
Okay, sounds good.
Just to give people a taste to understand what we are doing, because actually when it comes to education, it's important for people to understand how things are structured. But I know that in 1 hour it's going to be very difficult for people to grasp a full understanding of how things are run.
Yes.
And this is why if you have any questions, feel free to reach us at info@preppharma.com. We can schedule one-on-one. You can visit the website. The feature of the courses are listed on the website, so you can actually see that. But usually one-on-one, if you have any confusion, just to get an understanding, because I know there's questions going to be, when is the course delivered, how many hours per day, all of that is on the website. So you can visit the website and you can check that. So again, we can upload the video.
That's
Yes.
awesome.
Just a-
Yeah.
Absolutely.
Okay, so I'm going to look at if we have some questions.
Yes.
Now, there is a question about cost. How much does it cost? So the cost is on the website. I don't know it on the top of my head, but every course is actually there. How long does it take? What credentials you need? How many exams? So there, I believe here they're asking about the process overall.
Yeah.
So anybody can answer. If you decide to become a licensed pharmacist in Canada and you arrive to Canada today, how long the whole journey usually takes for you to become
According to the
pharmacist?
NAPRA, they estimate it to be 2.5 years. 2.5 years to pass the complete
To
process.
complete the process, 2.5 years. That's from processing time of the profile all the way
Yeah.
to passing.
Yeah.
the
According
exam.
to the NAPRA. Yeah.
But it differs, right? Like it depends on the
Depending.
personal.
If you want to do
experience.
MCQ and OSCE
Some people
together, you
decide
want
to
to
do
do them
both.
separately, because
And
let's
all
see
the
how
exams
the
are conducted.
fastest.
Fastest year to year and a half.
Yeah.
If they are deciding to go through both
Yeah.
MCQ and ASCII at the same
If
time.
passed the first time
And
with each
pass all
exam.
from
Yes.
the first.
Well, that's what Prep Pharma is
Yes,
to achieve.
exactly.
It's to guide people, because that's saving time.
Yeah.
And one thing Dr. Sara was mentioning about not passing from the first time, the first exam. I always advise people the same thing. In general, even if you're going to the exam with the attitude, I just want to see what it is, a failure is a failure. It's a trauma. It's
Yes.
going to register.
It's a
It's going to destroy
disappointment.
your confidence. It's
Yeah.
going to be so hard to recover from it. So it's much better to spend the time to prepare from the first time,
Yes.
clear it, so you don't have to go through these hassles. And that's what the intention of Prep Pharma is. Now, there is a question in general. I don't know if any of you know this, but they're asking about the passing rate of the exam in general. Like for the evaluating, do you guys know I know the statistics get published.
They are posted on
It is
PEBC.
posted on PEBC,
Does
and
anyone
they
know
keep
it from the
changing.
top of their head?
Yeah,
Anybody
the
knows?
evaluating exam since 2018, 2022,
Yes.
46%.
Okay, that's the
46.
evaluating. And for MCQ and OSCE?
Actually, I
I could comment a bit on the OSCE, but I have again to refer back to the PEBC website. Of course, they will have to cover all of the three criteria, which is the outcome, the communication, and the performance. And the points are all listed there in terms of like, let's say the outcome, you have to provide all the right information, accurate, complete information without missing any important points, gathering, for example, all important information for a specific interactive case. Also for the communication, that you have to have the clear and concise communication.
Yes.
For the overall performance, they want to see your overall demeanor and your approach to the OSCE station if you have finished that station within the 7 minutes time that they give you. But that's in general. Of course, you will have to again refer back to the PEBC website, but you have to be complete and concise in providing your information.
That's the criteria
That's
for
what
passing.
I'm
Do
asking.
you know like a percentage? Like how many people who attempt actually pass?
Yes, I actually did cover this, but
I
the
want
percentage
to-
should be on the PEBC
On the-
website.
I want to add something to what
But
Isra
do they
was.
distinguish between, sorry
Yeah,
to
no
interrupt
worries.
you, do they distinguish between internationally and Canadian graduates?
Yeah, they
Do
have
Yes.
that classification.
They have it,
They
that
have it.
classification.
They
Yeah.
have
I want to add to what Isra was mentioned. I understood from the candidates that there is a big change in the questions nowadays of the evaluating. In the past, I think, correct me, 4 or 5 years, they have shifted to more of like ethics and skills, and they want people to be well prepared even from the beginning. That's why here at Prep Pharma, that's what we are doing, is that we are keeping our material and questions up to date with what's being really asked now in the exams.
Yeah, the constant updating.
Yes. That's very important.
That's actually part of Prep Pharma, Prep Doctors. Like you have
Yes.
to keep updating
Yes.
because the concepts change, the focus changes, and so forth. So that's very important.
I believe in Prep Pharma, we build the skills.
Yes.
Not only you preparing for exam, we build skills to be ready for the market.
Canadian market.
The Canadian
So we
market.
are building skills more than preparing, just preparing.
So I have a question here as well. I think we answered this one. It's talking about where can I find mock exams? Is it available online? As we mentioned, we don't do only mock exams. Mock exam comes as the final stage of a course usually. Mock exams are very important. They do contain high quality information. That's why they are not going to be offered online. They're only offered on
And they're
site,
not offered separately.
and they're not offered separately. So another question, I think Dr. Abu Saleh, you touched on this. They are in different province. So as I mentioned, we do have locations in Vancouver, in Calgary, in Montreal, in Richmond Hill, and in internationally Dubai and Hyderabad. The idea here is if there is enough demand, we can expand there. But initially, the focus and the course is going to be delivered in Mississauga. I think that's pretty much it in terms of
And
questions.
just commenting on your point in terms of the final mock exams. So of course these exams are to test the candidate preparedness for the going through different types of the exams, right? We will provide final feedback to the candidates if they are exam ready, and based on the trackability, we will give them the guidance if they are ready for the exam or if they need further preparation.
This is very important, by the way, because what helps people advance is a structured learning.
Yes.
You know, instead of random learning and not knowing where they stand, they will have a structured learning. And one thing to comment on that, by the way, all of the quizzes and the exams in Prep Pharma, they get detailed analytics. So not only they get their score in the exam, but they also get the areas they lack in. So let's say they're weak in cardiovascular, they get an overall score, and then they get the cardiovascular score, like what they answered in this section. And this also helps in guiding people
On what to
where
revise, on what to
If they're
focus
strong in
more.
one area, they don't need to revise it. If they're
Yeah.
weak in another,
Yeah,
they can
that's
do that.
perfect.
Yeah, so thank you everyone for attending.
Thank you.
This brings us to the end of the session, and
Thank you.
I wish everybody.
If anyone
the
has
best
any
of luck.
questions, they just reach
You can
out
reach
and
to us.
we'll answer them.
And as I said, the website is preppharma.com. Email info@preppharma.com. There's a lot of details on the website. Feel free to send emails, book one-on-one sessions. We'll be more than happy to help you out.